It's Isaac Wade, pharmacy student. Let's talk about managing diabetes medications on sick days. Just a disclaimer, this video is not medical advice. This is for informational purposes only, and it's primarily intended for healthcare providers. If you're a patient, make sure to talk to your healthcare provider before making any changes to your medication regimen. Getting that out of the way, let's get into the video. Just a quick note, the information in this video comes from Diabetes Canada. So essentially, medications that are normally safe and efficacious for treating blood pressure or blood sugars, and these medications may also provide cardiovascular and kidney benefits. These benefits that these medications provide are very good under normal circumstances. However, when your patient becomes sick, if they're vomiting, if they're having diarrhea, if they're unable to consume adequate amounts of food and fluid, and if they're dehydrated particularly, the risks of taking these medications may start to outweigh the benefits. And for that reason, it's recommended to hold these medications until your patient is feeling better, and then to restart the medication once your patient is back to normal. So which medications am I talking about? There's a very good abbreviation. It's called SADMANS. And no, I'm not talking about Brampton slang here, but SADMANS, this is the abbreviation that helps to remember all of the different classes of medications that should be held if your patient is sick. So let's get cracking. Let's get started. S is the first letter of SADMANS. So S, this stands for sulfonylureas and insulin secretagogues. So some of these medications may include gliclazide, glyburide, glimepiride. I hope your patient isn't taking glyburide because that medication causes higher instances of hypoglycemia, but if they are, alas. So these medications we should hold. And why should we hold these medications? Well, we should hold them because these medications are renally cleared, and a buildup of these medications may increase the risk of hypoglycemia. So hold the S, hold the sulfonylureas, hold the insulin secretagogues. Next letter, A. A stands for ACE inhibitors. And the reason why we hold ACE inhibitors is because under conditions of dehydration, the chance of the ACE inhibitor causing acute injury and decreased kidney function tends to go up. So make sure you hold the ACE inhibitor. Next one is D, SAD. D stands for diuretic, and it also stands for direct renin inhibitors. So why do we hold diuretics? Well, diuretics cause diuresis, just like is in their name. And if your patient is already dehydrated, the last thing that you want is diuresis. That's going to exacerbate the situation. That's potentially going to increase the chance of kidney injury and electrolyte abnormalities. So make sure you hold the diuretics. There are some cases where if you have a patient on furosemide with heart failure, it may not be completely appropriate to hold the diuretic, but for most patients, holding the diuretic is going to be appropriate. So D stands for diuretics. M is metformin, metformin, right? If you're dehydrated, your kidneys aren't clearing as much as they normally are. So metformin is something that tends to build up. And the issue with the buildup of metformin is that it may increase the risk of lactic acidosis, a very rare side effect. Some people don't even believe that lactic acidosis exists in the context of metformin, but it is definitely a risk to consider. Next letter, let's talk about A, SADMA. A in this case stands for angiotensin receptor blockers. These types of drugs work through almost very similar mechanism to your ACE inhibitors, and for that reason, they carry the same risk of causing kidney injury. So make sure you hold the ARBs as well. The next letter is N, SADMAN. N in this case stands for NSAIDs. NSAIDs, admittedly, these drugs are not the ideal class of painkiller for your diabetic patients, but they're an especially poor choice if your diabetic patient is also acutely ill and if they're experiencing dehydration. So make sure you hold the NSAIDs as well. That will help to prevent the risk of kidney injury. S is the last letter of SADMANS. S in this case stands for SGLT2 inhibitors, your sodium glucose cotransporter 2. And these drugs are really great. Lots of really amazing indications, lots of new studies of where they find efficacy of these drugs in all these new conditions like heart failure and kidney disease and whatnot. Unfortunately, these drugs also contribute towards diuresis, right? They cause our patients to pee out sugar. They cause increased amounts of diuresis. And for that reason, something that may exacerbate the dehydration that your patient is experiencing, and you're going to want to hold the SGLT2 inhibitors to again lower the chance of having a decline in kidney function. So before I let you guys go, I just want to note a particular issue that there seems to be a lot of misinformation that surrounds, and that is insulin on sick days. So on sick days, when your diabetic patient is sick, contrary to your intuition, contrary to their intuition, I think perhaps this is some misinformation that patients tend to have a lot of the time. But your patient, when they're sick, they're not going to experience hypoglycemia. They're not going to have low blood sugars. It's much more likely that they're going to have hyperglycemia, high blood sugars. The reason for that is because of the stress hormone cortisol. There's increased cortisol when your patient is acutely ill, and of course that will raise the blood sugars. And for that reason, what often happens is a lot of patients will discontinue their insulin on days that they're sick. That kind of makes sense intuitively. If they're discontinuing their sulfonylureas and insulin secretagogues, if they're not eating as much food, if they're not able to have as many carbohydrates, it really does make sense for your patient, from your patient's perspective, to discontinue the insulin. However, what happens is that lack of insulin and those increased blood sugars from the cortisol really skyrocket the patient's blood sugars, and they can wind up in the hospital. So make sure your patient is not discontinuing their insulin. Absolutely measure the blood sugars more frequently and make adjustments to the insulin as needed. But under no circumstances should your patient discontinue the insulin or hold off on the insulin simply because they're sick. So that's something that I wanted to add in. Thank you guys for watching the video. I appreciate it. If you found value in this video, if this video helped you out, feel free to like the video and subscribe. And if there's something I said in this video that sounds wrong or uninformed, please let me know in the comment section below so that we can have a discussion about it. So thank you guys again for watching, and I look forward to seeing you in the next video.